Hello and welcome everyone. Can everyone hear me okay? Either just give me a thumbs up or great. Great. Well, good evening. My name is Melissa Lee and I'm the Director of Admissions and Regulatory Compliance here at Penn Nursing. Welcome to the first of a series of 3 webinars entitled Diverse Perspectives in Nursing. This webinar series also is kicking off our partnership with the Thurgood Marshall College Fund. TMCF supports students attending their network of 47 historically Black colleges and universities known as HBCUs. And I'm proud to say I am an alumna of the first HBCU, Cheney University. So welcome students, alumni, administrators who are representing those institutions and other HBCUs tonight. I'd also like to welcome other prospective students that are joining us this evening. It is extremely important to Penn Nursing as well as the nursing workforce to be diverse. And our dean, whom I will introduce momentarily, will elaborate more on why diversity and diverse perspectives in nursing are vital to the profession. Before I introduce the dean and my colleagues, I just wanted to speak to a few housekeeping comments. We are recording this session and we will send it out to everyone in the next few days. So we'll be sharing a bunch of slides. You don't have to worry to try to copy everything down. We'll send it out to you, a recording. Feel free to turn your cameras on as well if you like or not. Also, if you could keep your mics on mute while the presenters are presenting. We will have a Q&A session a little bit later on at the end of the presentation. So feel free to type in any questions that you might have into the chat box, and we'll do our best to address them later on, or they may be addressed throughout our presentation. Also in the chat box, let us know where you're tuning in this evening. We always like to know who is the furthest person attending. Also, if you're representing one of the HBCUs, please shout out in the chat box which college or university you're representing. So now I'd like to introduce my colleagues who will be presenting this evening, and then I'll introduce our dean. First, I'd like to introduce Philomena Cercelli. She's our Associate Director of our Accelerated Second Degree BSN program. Then I'd like to introduce Jamie Bergstein-Eidlin. Did I get it right, Jamie? She's our Associate Director of our Graduate Programs and Marketing. And next, I'd like to introduce Antoinette Otiri. She's our Director of Financial Aid. Our agenda this evening will be as follows. We'll have a welcome from our dean, and then we'll move on to Philomena. She'll give a brief overview of our Accelerated Second Degree BSN program. Moving on to Jamie Bergstein, she will give an overview of all of our graduate programs. That's our MSN, our DMP, and our PhD program, and followed by Antoinette Otiri. She'll give you an overview on financial aid. We have a new exciting scholarship that I believe the dean and Antoinette will speak to that we're going to talk about this evening. And then we'll save some time at the end for a Q&A. Dean Antonia Villarreal is the Margaret Bond Simon Dean of Nursing. She has been serving as our dean since 2014. She is the 6th dean of the school and is the 2nd alumna to serve in this position and the 1st dean to serve who has prior and current NIH funding. Dean Villarreal, thank you so much for joining us this evening. And now I will turn it over to you.
Great. Hi, everybody. It's good to see you all. I think, as tight as we are about Zoom meetings, it's so wonderful to get people from across the country to be together tonight. And I want to I'm seeing where everybody's from. We see people, of course, from the Northeast, from California, and a bunch of people in San Francisco, a couple of people from the Midwest. And I want to shout out to Modestia Dowd, because I'm from Detroit as well. So Philly's my second.
Modesty, but hey.
Modestia, right. So are you from the east side or the west side of Detroit?
West side.
Me too. The west is the best, the east is the beast. So.
Yes, it is.
So great to see you and great to connect with you. I'm really excited for you to be here today so that I can tell you all about how wonderful Penn is and how wonderful nursing is. And it's hard to separate the two. Let me ask you, since you all put yourselves in the chat, because I know we have a variety of students here, how many of you are interested in a BSN, in the BSN program? Just type your name in there. And if you're MSN, put MSN in there. Second career, put second career. PhD, put PhD, and it could be all three. Very good. Very good. So it's, there's just so much to talk about in nursing. I don't even know where to start. And I want to tell you, we have it all here at Penn, from BSN entry to second career BSN to advanced practice nursing. I see somebody's interested in DNP and anesthesia. It's a great school and a great place to start your nursing career. We are great because we have a dedicated faculty who care very much about students, who are excellent and world-class faculty, researchers, practitioners. We have surrounding us a health system at Penn Medicine that's extraordinary. But not just the health system at Penn Medicine. We have the VA Medical Center that's in walking distance, as well as the Children's Hospital of Philadelphia. And then we have our entire community in which we do a lot of work in both West Philly and I would say around the world. At least we did that pre-COVID, and we're doing that telehealth or telelearning as well. And we'll look forward to the days when we can travel again, because many of us do research and scholarship in those particular area. So those are all some of the reasons why Penn is ranked #1 in the world. But importantly, what you have to figure out is Penn Nursing the school for me? And I will say, yes, it is the school for you for a lot of different reasons. So, we have again, we're an Ivy League. We're the only Ivy League school that has a BSN program. We were the first Ivy League to have a PhD program. And again, we've been leaders in the area of education before. But I think what's special about us and about our faculty too is that regardless of the accolades and the research dollars that we have, we care very much again about our students, and we care very much about our communities. Our social justice, diversity, equity, inclusion are central to who we are, and that's something that's certainly been a priority since I've become dean. And again, I'm thrilled to be in a university that carries inclusion as one of its primary pillars. And again, I think the commitment of our president to inclusion and also to nursing, I think speaks volumes about how nursing is valued are here. But what really makes us #1, and again, in addition to our faculty, is our outstanding students. We attract the best, and I'm going to believe that you are the best, and that's why we're interested in bringing you all here to Penn. I see all these smiles because you're the best, don't you? So we want you here. We want you here with us in a place where you can thrive. I know many of you that are from HBCUs are in that type of environment where, again, you not only get great support, but again, great support to be the type of scholar, to be the type of practitioner that you want. Certainly, there's been a lot of attentions to HBCUs because our Vice President, Kamala Harris, as we all know, is a graduate of Howard University. The new senator from Georgia, Reverend Raphael Warnock, attended Morehouse. Stacey Adams is an alum of Spelman College. Melissa Lee had to brag about her HBCU creds from Cheney, and I know there's some Cheney grads. And I will tell you, my best friend, Loretta Jamont, is a graduate of
Be part of the tango.
Somebody needs to put their microphone on mute. But my colleague Loretta, oh, Hampton, how could I forget? She was a Hampton grad, and not only was she a Hampton grad, but as she likes to tell me all the time, she was Miss Hampton, the first nurse to be Miss Hampton. So, so again, quite proud of her, of the background. I want to tell you, one of the things that's special about Senator Warnock is not only is he came from an HBCU, but he has a commitment to first generation students, and he was first generation, just like I was. As I mentioned, I grew up in Detroit. Modestia knows I grew up in Southwest Detroit, so big Mexican neighborhood. My father was a Mexican immigrant. My mother was born in Detroit, but her parents migrated from Mexico. And so I'm first generation. And again, I had 3 brothers. So, we have a very traditional family, and girls usually get the short shrift. But luckily my mother advocated, and she wanted me to not only go to college, but also make sure that I had an education that would make sure I had a job for the rest of my life, so I wouldn't have to depend on anyone. And I think what my parents didn't realize, what I certainly learned, is that being a nurse is more than just a job. It really is a career. And I've just been, again, like a kid in a candy store, with all the possibilities that are open to nurses at every level. I say to students, I say to faculty, your biggest challenge in coming to Penn is figuring out what to say no to, because there's so many opportunities and so many things to do that can help you build the type of career that you're wanting to do. So, again, as I mentioned, what's important about the school and also the university is commitment to first generation students, because we believe that that's an important way to diversify the workforce as well. And the supports that we have for all of our students, in particular our first gen, are bar none. I want to assure you that if you come into Penn, this is not, we're going to throw you in the water and see who can swim. We are here to help you swim. We are, we have lifelines, we have tugboats, we have everything. So if you get accepted here, it's because we know you have what it takes, and we are going to see you through. And the people that are on this webinar today, Melissa, Antoinette, our student services folk, are all here to help you succeed. So again, it's great that they're here with us today. So I would hope, and again, I appreciate your interest in nursing. For those who are thinking about this, I don't think there's a better time to be a nurse during this time, during a pandemic. I think you've seen nurses not only at the bedside and not only helping people transition from this world, but also advocating. I think you've seen pictures of nurses mandating, standing up in front of cars waiting to be run down to insist that people wear masks, who advocated for people. And again, this pandemic isn't going to end anytime soon. And the aftermath of that, in terms of what that means in terms of chronic conditions, nurses are needed now to help convince people that a vaccine is a good thing for themselves and their communities and families. We are at the heart and the center of all of this. And as I said, a degree in nursing is just a way for you to, again, to continue. The doors are wide open with this. I want to share with you that although she's not a Penn nursing student, she is one of my students when I was at the University of Michigan, and that's Congresswoman Lauren Underwood, who's from Illinois. Lauren was an undergrad student, and she wanted to do a policy paper, and I said, well, that's really interesting. Why is that? And she said, I want to run I want a federal appointment, a presidential appointment to run a major HHS agency. And then she named all the agencies. And I said, oh, she is pretty serious here. She's going to go pretty far. So we started our work. And again, the work that she's doing is phenomenal. She's really leading the cause on maternal mortality, specifically among Black women. So I'm so proud of her and look to support her. But that's an idea of, again, what it is that you can do here. As Melissa said, again, we're excited about the new Gutman Leadership Scholars Program that will be beginning this year. Dr. Gutman decided, I'm so thrilled, she could have invested any place in the university, but she decided to put her money on nursing and in developing leaders that you all are, whether you work at the bedside or whether you work in the halls of Congress. And again, particularly interested in those that have a commitment to working with underserved communities. So I could go on and on and on and on, but my colleagues will help me go on and on. And again, just, again, share with you the opportunities that we have here at Penn. As I said, I know I'm talking to the best here, and you deserve to be at the best. And I hope you find that here at Penn or wherever you go. So enjoy the rest of your evening. I'm going to tune in and tune out. Great to see you all, and hope to see you again sometime soon. Melissa, I'm going to turn it back over to you.
Great, thank you so much for joining us this evening and the welcome. So now we'll move on to the rest of our agenda for the evening, and I will turn it over to Philomena.
Thank you. We're going to pull up the PowerPoint and we're going to talk a little bit about our accelerated programs today. So, here we go. Okay. So our accelerated program here at the University of Pennsylvania at the School of Nursing is designed for students who have or will have a bachelor's degree in a non-nursing field and are looking to go into the nursing career. And we have 3 options under the accelerated nursing umbrella. Students can apply to our BSN second degree program, which is for students who know they want to go into nursing. They're looking to become a registered nurse, and they're still kind of figuring out what specialty they might be interested in, what population they might want to work in, with, the setting that they want to be involved with. So they can apply to the BSN second degree at Penn, complete their BSN, second bachelor's, sit for the NCLEX exam, become a registered nurse. And then from there, your options are limitless, coming back to get your master's, getting a DNP, PhD, going into public health. It's just endless in terms of what you'd ultimately like to do. The second option that students can choose under our accelerated nursing umbrella is our BSN MSN program, which is for students who know they want to go into nursing and they also know the specialty they'd like to complete. So I know I want to be a nurse midwife. I want to work in family as a family nurse practitioner. I'm passionate about acute care and want to be working with trauma and acutely ill patients. If you know the specialty, pediatrics, whatever it is, psych mental health, you can apply directly to both the RN component and or the advanced practice nursing component, which is usually our nurse practitioner tracks, our nurse midwifery track, as well as administration and leadership. And you can apply to both at the same time, and then students are admitted to both at the same time. So you can come to Penn knowing I'm going to finish my BSN, I'm going to complete that, become a registered nurse. Sometimes students will go straight through and finish their nurse practitioner or nurse midwifery certification and attain their MSN, or sometimes they'll go out into the workforce, work for a few years, come back. And you're going to learn a little bit more about the master's program when my colleague Jamie does her section. So you'll hear a little bit more about all the specialties that we offer and how that piece will work as well. The beauty of the BSN MSN program is that you are notified at the same time that you're admitted to both programs. And we do allow our students to complete additional graduate level courses that count towards your master's degree while you're finishing that bachelor's component. And then we have our Hillman BSN to PhD program, which is a scholars program. There is a scholarship attached to that as well. And that is for anyone who knows they want a PhD in nursing. They're interested in the research world, in academia, and it's a direct entry from the bachelor's into the PhD program. And it doesn't matter which option of the 3 that you choose, the BSN portion is one cohort together. So you all come in together, you all start at the same time, you all finish the BSN at the same time. And then after that, it's completely up to you in terms of what your next steps are. And everyone does something different based on their goals, their career, life circumstances, whatever it is that they're looking for. Next slide. So our accelerated program, we only have one start date a year, and we currently are starting in the summer. So we usually start in early June, usually the second Monday of June. And the length of the BSN is 18 months. So if you were to apply for next year, which would be June of 2022, you would graduate with your BSN in December of 2023. Sit for the NCLEX exam, become a registered nurse, and then, like I said, go into the workforce, or if you're in the master's program, go into your MSN program. Of course, if you're a PhD student, it's the same thing. You would sub-matriculate and go straight into the PhD as well. Now, some of the length of the graduate specialties vary. The nurse practitioner specialties are all between 12 and 16 months full-time. Our nurse midwifery and administration track are 18 months full-time. And the beauty of our master's program is that the majority of those programs can be completed part-time, which you'll learn a little bit more about later. So it gives you a lot of flexibility of working full-time as an RN while going to school to get your BSN, your MSN. And we also offer opportunities for students. Some of the programs that you might apply to, which you'll learn a little bit in a little bit, requires work experience. So you can still apply BSN, MSN to peds acute care to concentrate in oncology, but after the BSN, you're going to work for at least a year in the field and then come back and finish your master's. But your spot is held, you go out and meet the work requirement, and then you don't have to reapply. You can just come right back in. So just a little bit about our enrollment goals. The nice thing about our accelerated program is that we're a really small cohort. Our goal is to bring in a class of about 85 to 90 accelerated students a year. And that's a combination of all three of those options. We have an anticipated admit rate of between 30 to 35%, give or take. That can be a little bit higher some years and a little bit lower some other years. We're a national program, so students come to us from all over the country, international students as well. Usually every year we have at least 17 states represented, and we usually have a nice number of students that are from abroad as well. So it's a really diverse group, just in geographic alone, but that's something that we really work towards in the admissions office at the school, is to kind of have that diversity of, the beauty of the accelerated program is that everybody's coming with a different background, different education, different majors. Some have 10 years of working in corporate America and are coming back to nursing. Others have been studying, the sciences in college and are coming straight into nursing. Others have been involved in research, maybe bench science research, and they're leaving that to go into clinical practice. So the diversity of backgrounds and interests really make this program and the cohort so dynamic. So in preparation for the accelerated program, there is a little bit of work that needs to be done prior to kind of preparing yourself to apply for the program. So if you are interested in the accelerated program, you have a non-nursing bachelor's degree, there are certain prerequisite courses that you have to complete. You can complete these courses at any accredited college or university, including online. If you do take an online course, you just want to make sure it also includes a virtual lab as well. You must have a C or higher in all of these courses in order for them to officially be approved and transferred in for credit. The prerequisite courses are really introductory courses. You don't have to go crazy advanced science, just keep it simple and you will be fine in terms of matching those classes. But if people have any problems or any concerns, you can always email us. We're more than happy to answer questions in terms of, I took this chemistry course, but the title of the class doesn't make sense. Will it count for chem? We can try to work with you and figure it out. But keep it simple. So 2 semesters of anatomy and physiology with lab. You want to make sure it's human anatomy and not comparative, because we're not able to accept a comparative anatomy course. Human anatomy, make sure they have the labs completed with that. The one thing about the prerequisite courses is that we'll go 10 to 12 years for most of the prereqs, with the exception of anatomy and physiology. Anatomy and physiology should be completed within the last 5 to 6 years. It's a benefit for you as a student when you start the program, but it's also something that we find that is really important in terms of success within the program. So anatomy and physiology, intro to chemistry with lab, 1 semester of intro to bio, 1 semester of microbiology, all with lab except for biology. Biology does not require a lab. And then we also require intro to nutrition and intro to statistics. And of course, if you're able to find this class and you're able to take the class, you can also do a healthcare ethics or bioethics course, because that will transfer in as well. If you are on a quarter system at your college, if your college offers microbiology as a 1/4 micro course and it's introductory, we will accept it. Usually the credit hours match anyways, so it works out. So just because I have semester there, it doesn't mean that we won't accept quarter courses as well. Okay, so these are the prerequisites. This probably takes the most time. You can apply to our program while you're completing your prerequisite courses. Okay, now the little caveat is if you are a non-science major, meaning if you were an English major or theater major, accounting, you want to have a good number of science courses completed before you apply. It just helps you become a more competitive applicant. So think about that as you're planning out your courses. You want to make sure if you're going to take classes this summer and this fall that maybe you front load some of those science courses so that when you're ready to apply, we have some final grades in your sciences, because it does help you in terms of as an applicant when we're reviewing these prerequisite courses to know that you've completed some sciences. If you're a science major, there's a little bit more flexibility there because you've completed so many other courses that we can look at to evaluate as well. So those are the prerequisite courses. All right, just a little bit on the timeline, just so that everyone can have a big picture idea of, of what to do and when to do it. So our application will go live this July, July 2021. Our application deadline is October 15th of 2021. We don't currently have rolling admissions. So deadline's October 15th. Once the deadline hits, then we start to review applications and then decisions go out all at one time. And we hold admissions committee in the month of January, and our notification is early February of 2021. So decisions all get released at the same time. Everyone finds out at the same time. Of course, this can change between now and next year, but this is kind of the plan right now. Early February, and then our program starts in June. So it is almost a full year process in terms of getting ready and preparing for the application process. The good news is that everyone's here. So that's awesome. So you have plenty of time. You have us as a resource, me as a resource with questions and things as you kind of prepare, whether it's with your prereqs, whether it's with your application, whatever it is. Okay, so let's just set the timeline. So just remember this summer, you want to start looking at our application and seeing what the requirements are. So, well, I can tell you now what the requirements are, but then you want to check again this summer. So the application, the great news is we have a wonderful online application system. Everything is submitted electronically. It's a really user-friendly application. Personal statement, why nursing, why Penn, what your future goals are. We have a question prompt that we give you. It's really important to address why nursing is a good fit for you. There's a lot of wonderful careers out there where you can go into clinical practice and not be a nurse. But why is nursing the right fit for you? What do you hope to accomplish? How does it help you meet your goals in terms of the service and the work that you want to do? So it's really important that you take the time to really address the transition from if you were, a business major going into nursing. What kind of triggered that change and that switch? If you've always been interested in healthcare, why is nursing the right healthcare career for you? The personal statement is one of the most important aspects of the application. So you want to really think about, why am I picking this career? Why is it a good choice for me? And really make sure that you can articulate it, because that's really what we're looking for. We want students who are going to be passionate about the field, who've researched the field, who understand the roles of the nurse, an advanced practice nurse, midwife, whether it's being a midwife or a nurse practitioner. And then also talk a little bit about your goals and what you hope to accomplish. Goals change. We're not going to hold you to it. We won't pull up the personal statement 5 years from now, but you want to kind of think about, once I have this degree, once I, attain this certification or this license, this is how I see myself practicing. And this is what I see. And this is how I'm going to be contributing to the field. And then a little bit on nursing. A little bit on why Penn. What is it about the university? What are some of the opportunities you want to take advantage of? Those pieces really help make that personal statement strong. So you want to make sure you take the time to really think that through and share that with us. We require only 2 recommendations for the accelerated program, but you may submit up to 3 recommendations. One, we strongly recommend that one recommendation be an academic recommendation, especially if you are currently in college or just recently graduated. Now, if you've got 10 years of work experience behind you, supervisor recommendation is wonderful. And you can definitely submit a supervisor recommendation, even if you only have 3 years of work experience behind you. So really think about, people that can write a recommendation to talk about your academic abilities, your characteristics, your leadership skills, address maybe, why you're going into nursing, why they think it might be a good fit for you. Those are things that we're looking for in those recommendations. All of your college transcripts The nice thing is that we currently are not requiring official transcripts when you apply, so you can actually submit your application with unofficial transcripts. The resume. So the resume for this application, I like to kind of just highlight is that you want to give us as much information as possible. And sometimes some information doesn't fit in the application. There's not a question that addresses it. You can include anything you want on the resume. It can be 2 pages, it can be 3 pages. You want to highlight your healthcare experience, but you also want to highlight all other aspects of your life. We are a holistic admissions office. We review holistically. We review every application in its entirety. We're looking at the applicant as a whole person. So we want to know hobbies, where you've traveled, languages you speak, activities you've been involved in, whether it's related or not related to healthcare. If you volunteer, maybe your volunteer experience is not related to healthcare, but you've been volunteering for the last 5 years, in a soup kitchen or with the food bank or whatever it is. So we want to know those things. So make sure that you include that in your resume. It doesn't have to be a work style resume of 1 page, it can be a few pages, because it's something that we really like to see. It gives us a little bit more information on you as an applicant in terms of your interests, your goals, and what you've been involved in. Also, any clubs, activities that you want to include, you can as well. The GRE is currently required for our BS and MSN students. And we do have a GRE waiver for anyone who's applying to the BS and MSN program. If your GPA is a 3.2 or higher, or you've completed a graduate degree, the GRE is waived. But just hold off on taking the GREs. If you were planning to take the GREs for Penn, if you're taking it for another program, continue. But for Penn, because that requirement may change. Then we also have a video interview that's part of our application process. And the video interview is just an opportunity to get to know you a little bit better. There's a few question prompts where we ask you a little bit about yourself. And it's really, we're not going to put a huge emphasis on the actual, the lighting. We're not looking for like YouTube influencer videos. It's really just be yourself, be conversational, tell us about your goals, your interests, why you want to come to Penn. We talk a lot about health disparities, your commitment to it, your understanding of it, how you hope to impact health disparities in the future, questions like that. And it's really just an opportunity to really just get to know you as much as we possibly can, especially in this world of the current pandemic. We can't even meet in person. So the video interview has been really wonderful to try to get to know our applicants. But that's another aspect of it. And then we also have our financial aid requirements. So that's the application requirements itself. And I'm going to talk a little bit about kind of big picture, what we're looking for. I talked a little bit about it already. I want to go to the next slide. So there's kind of two sides to the admissions process. It's a holistic approach, but there's the quantitative side of your application, right? Which is your undergraduate GPA, which is your science grades. And those are 2 things that we really look at, more specifically your science grades, as well as anything you've recently completed. So I say this because if you took chemistry freshman year and it was 6 years ago and you didn't do that great in it, that's not going to be that one course is not going to ruin your entire application process and you're not going to get accepted. But if you took a class last semester and it didn't go as well, that's a little bit more difficult and it is as an admissions committee. So whatever you're doing as you're preparing to take these prerequisite courses, as you're finishing your bachelor's degree, if you haven't graduated yet, really make sure you set yourself up for success. Take the time to take these classes so that you can do really well in them. When we're evaluating the quantitative side of your application, your anatomy and physiology grades are really important to us. So take the time, make sure you're taking them at a place and at a time in your life where you can really kind of perform, because those courses will help you be successful within the program when you get here. And that's why they play such a big part of the admissions process. So anatomy and physiology is something that we look at, as well as anything you've recently completed. The GPA, we have the average GPA of the admitted class is a 3.5, but I promise you every year we accept students that have a GPA under a 3.0 because we're looking at the whole applicant as a whole person. So there's so many different aspects that we look at. So you just want to make sure that if you haven't taken some of these prereqs, that you set yourself up to be successful and make sure you take them at a place where, you're going to get those high grades. Exposure to healthcare is the other piece that we're looking at. Now, I know currently it's a little bit difficult with the pandemic. And I know I've heard from a lot of prospective applicants that it's really difficult to get into different settings. Fingers crossed by this summer, things will start to open up, but you want to make sure that you give yourself an opportunity to shadow, volunteer, just get involved as much as you can within that healthcare world, because that is something that we're looking at. You know, have you met a nurse? Have you spoken to a nurse practitioner? You want to be a midwife? Have you spoken to a midwife? Have you shadowed a midwife? You know, those are things that we're looking for. We want to make sure that the applicants have taken the time to really research the career and that they know it's for them. So that when they start here, it just all fits and you're going to be successful when you're here. For us, exposure to healthcare is a lot of things. It's not being a CNA or an EMT, which if you are, that's great. It's everything. So it's from shadowing experiences, volunteering, inpatient or outpatient, clinics, family practices, you name it. We also have students who are involved in clinical research. So the majority of their day is in research, but they've got that connection with maybe potential patients or other healthcare providers. So really think about your experiences and your background and make sure you highlight them in your application. Because sometimes I'm surprised, sometimes you don't realize that you have these experiences because you don't think they're important, but they are. So really take the time to think about what drove me to nursing and what experiences have confirmed that, and make sure you highlight that in your application. So those are the two big things we're looking at, right? Is that exposure to healthcare, that it's a good fit for you, that you've taken the time to explore it, as well as some of those prerequisite grades as well. And the next slide. This is just a sample plan of study for the BSN. And again, this PowerPoint will be shared. It's a 5-term, starts in the summer, ends the following December. And it's basically 5 semesters worth of coursework. Okay, so this is just some opportunities that are available. Honestly, this goes across pretty much almost any of our programs for the most part, any of our degree programs. But I think the one thing that really makes Penn Nursing stand out is that you're first and foremost a University of Pennsylvania student. You have access to the entire university, you have access to all the resources, all the research, the faculty, the interdisciplinary study, all of these wonderful things that are happening on campus, you have access to because you're a student. But then the nursing school is this small community. We're only about 1,300 students from the BSN to the PhD. You're really going to get to know your cohort, the faculty, the staff, and you're really going to feel supported. So it's the best of both worlds, that small community environment, as well as this large university that has endless resources with a wonderful healthcare system, research centers, you name it, Penn has it. And as a student, you get to take advantage of it. So whether it's working in research, whether it's joining student organizations, whether it's doing combined degree programs with our master's in public health or a master's in bioethics, or business administration or master's in law, that is the beauty of kind of being on the Penn campus, is having all of that at your fingertips. State-of-the-art simulation lab as well, which is part of our learning component here at Penn. And then 2 more specific ones is our sub-matriculation option for our second degree students, which I want to bring up. So if you are a BSN second degree student and you're not sure of the specialty you want to go into, but you get into the program and you go through your peds rotation and you realize like, okay, I found it. I'm definitely interested in peds acute care. You can apply and sub-matriculate into our masters. You do have to apply. Knock on wood, lately, our students have been very, very successful. We have a really high acceptance rate as for our sub-matriculated students, but you can apply to the master's while you're here at Penn, completing your first degree. So know that there's the beauty of nursing, and also the beauty of Penn is that no matter what option you choose, you're going to be able to change your mind, switch your program, take a different path, you know, not do the master's and go get your PhD, go get your MPH. There's just so many roads that you can take when you're a student here. And the support that you're given by the faculty, by the staff, will only kind of continue as you're here longer. And then we also have wonderful study abroad programs that are available at both the bachelor's and at the master's level. And we have a variety of different options. All of them are pretty much short-term study abroad programs though. 2 weeks, observationally based programs to learn a little bit more about healthcare systems across the country, across the world, comparing them to the US, that sort of thing. And every year there's a change in terms of which programs are available for students. Obviously, we haven't had study abroad for over a year. We probably won't have any study abroad this spring or summer, but maybe in the fall they'll come back. But just know that that global health component is also available. It's another aspect of Penn Nursing. All right. I think that's my last slide. Yes, that's my last slide. Okay. So thank you. Sorry, I was probably talking a mile a minute, but I didn't want to talk too much because I talk a lot. But now I'm going to hand it over to my colleague, to Jamie. I'm going to hand it over to Jamie Bergstein-Eidlin.
Hi, everyone. My name is Jamie Bergstein-Eidlin. I'm the Associate Director of Graduate Admissions here at Penn Nursing. I am going to attempt to go over all of our graduate options in 15 minutes. I don't think that's possible, so I also apologize for talking fast, and just know that you can always reach out to us if you do have questions after this presentation. So first up is our MSN programs, which lead to nurse practitioner license, which is an advanced practice nurse. As you can see, we have a variety of populations to specialize in and acuity levels. So that means you either specialize in primary care, which is generally stable visits. For example, growing up, you went to the pediatrician every year. You go see your primary care physician annually. Hopefully, I'm guilty of skipping those once in a while. So that is generally primary care is well and stable patients. Acute care is chronic, unstable, complex patients. And as an advanced practice nurse, as a nurse practitioner, you also specialize in a population. So for example, if you become a pediatric primary care nurse practitioner, you can only work with pediatric patients at the primary care level. That doesn't restrict where you can work. It does not restrict in what type of organization you can work in. It just means that you couldn't treat adult patients or you couldn't treat acute care patients. So keep this in mind. Some of you may know exactly what you are interested in. Some of you are still exploring, but just keep that in mind as you explore these programs. We also have 2 administration programs, which do not lead to a nurse practitioner degree. Again, they are on the admin side, as the name implies. Our clinical MSN curriculum, this is very simplified. You can see sample plans of study on our website for all of our programs. But basically, all of our clinical programs follow roughly the same process, which is everyone takes the 3 Ps, or our core curriculum, which is advanced pathophysiology, pharmacology, and physical assessment. You take theory courses in the population that you're focused in. Everyone takes a research course, and then there are clinical placements in Pennsylvania, New Jersey, and Delaware. We organize your clinical placements for you, which is a huge burden off your shoulders. And for those of you who are not familiar with the Northeast, New Jersey and Delaware are actually very close to Philadelphia. So you may be traveling for maybe an hour or so for your clinicals, but the borders of New Jersey and Delaware are fairly close. And this is what our administration programs look like. The main difference between the health leadership and nursing and healthcare administration is really more flexibility amongst the programs. And the nursing and healthcare administration program does have an administrative practicum. So these programs are designed for those who are interested in the administrative side of things. You may become an advanced practice nurse and decide to get one of these degrees, or you may go in with your BSN as well. There are a lot of different pathways to working in the administrative side of nursing. We also offer a variety of minors, which are around 3 classes. Some are just designed to increase your knowledge of a certain area. Others allow you to sit for a national certification. So for example, adult oncology or palliative care, upon completion of one of these minors, you could sit for a national certification to be certified in one of those areas. You can complete our MSN programs full-time or part-time. About 2/3 of our students are doing an MSN program part-time, so it is very popular to do a program while still working, which is a flexible and affordable way to get a graduate degree. Our part-time programs, you can start in any semester in the spring, which is mid-January, summer, late May, or in the fall semester, which is late August or early September. The full-time start dates are specific to the program that you're interested in. So when you are ready to apply to one of our MSN programs, do keep that in mind if you are interested in applying for full-time. Our acute care programs do require work experience. All of them require at least 1 year of experience in that population and acuity level. Our neonatal program requires at least 2 years of RN work experience. And all work experience should be calculated after orientation or any probationary period. Keep this in mind because some orientations or probationary periods could be 2 to 3 months long. So do keep that in mind if you are interested in applying shortly after you start working. We recommend at least 1 to 2 years of work experience for all of our programs, even if you are applying to primary care programs. Our most competitive applicants do have some work experience under their belt. We just find it makes them a more competitive applicant. They understand a bit more about the nurse practitioner role and what they're applying for. And we do find that they have a more rewarding and a more enriching time in their clinical experiences and securing a job after graduation. Next, I will briefly go over our 3 different DNP programs. So the first DNP program, which I heard a few people were interested in, is our DNP in nurse anesthesia. This program leads you to become a certified registered nurse anesthetist, or CRNA. This program is only offered as full-time and it is 3 years long. You can just enter with a BSN. You don't need any advanced degree. And you do need at least 2 years of ICU or critical care experience working with the most critically ill patients. And again, our most competitive applicants typically have more than 2 years of work experience when applying. The curriculum is fully integrated between your didactic, simulation, and clinical classes. So what that means is a lot of programs might do 1.5 years of classroom and then 1.5 years of clinicals. Not us. We start you right away. Only a few months into the program, we throw you right into your clinicals. So it's fully immersed. We have 8 primary sites and 6 specialty sites. Our specialty sites include cardiothoracic and non-cardiothoracic, pediatrics, obstetrics, in Pennsylvania, New Jersey, Delaware, and we do have clinical rotations at Baltimore Shock Trauma and Johns Hopkins University. We have 2 different postmaster's DNP programs, which means you need to have an advanced degree. We have the postmaster's DNP program and then the executive leadership DNP program. And the main difference between the 2 of these is the type of cohort and experience that you have coming into the program. So the executive leadership program is designed for people who have significant leadership and executive experiences, as well as some financial management experiences as well. Both programs are 2 years part-time and 100% online. There are a few on-campus experiences, but your coursework will be 100% online. These 2 programs, as well as the anesthesia program, end with a DNP project, which is designed to analyze a system or organization, improve upon or create something that would, in general, improve healthcare outcomes, either for a specific organization or general area. You don't need to know exactly what you are interested in. It's a good idea to have that, but it's certainly not required for admission. You can work in pairs or groups for all of these programs, and there are courses throughout the curriculum to help you design and work on your DNP project. And last but certainly not least, we have our PhD program. There are two goals of the PhD program. One is to develop as a scholar, and two is to develop as a scientist. The goal of these programs is to really transform you into a nurse scientist. Our full-time students are fully funded for the first 4 years, which includes a stipend, a living stipend, tuition, fees, and health insurance. This is a very brief overview of the PhD program curriculum. You take 7 core courses, you get into your concentration courses, and then you have a teaching or research residency. What's really nice about the PhD program is you do have the opportunity to take some classes at different Penn schools. So if there's a really interesting statistics sequence at the School of Social Work or elsewhere, you do have the opportunity to take courses at other Penn schools. Now, this slide certainly does not list all of our advantages, but I'm just going to highlight a few. As I mentioned, for our clinical programs, we secure your clinical placements for you, which again is a huge burden off your shoulders to know that you are admitted with a clinical placement. Our clinicals focus on the community and often on the medically underserved, which leads me into the next part, which is community focus. Geographically, we have a big community focus. We are located in West Philadelphia, and we do a lot within the community to make sure that we are serving members of the community. So for example, for the past few years, the Center for Global Women's Health at Penn Nursing has hosted the West Philadelphia Women's Day, which organizes education, resources, and services for members of the West Philadelphia community. We also make sure that we foster the community at Penn Nursing. And as a student, you are part of the University of Pennsylvania. So there are a lot of centers, there are a lot of student organizations that you can join. There are health services, there are academic services. So we make sure that, geographically and also within the school that you are supported and made to feel as part of the community. We have national and international opportunities, as Philomena mentioned. Of course, those are kind of on pause, but there are some domestic opportunities where you might be able to do a clinical at another hospital in the country, or do clinicals abroad or short-term study abroad opportunities that we hope to resume very soon. Even if you're not in a PhD program, you can still get involved in research. All of our MSN programs require a research course. Many of our students are ready to be published at the end of that and do go on to publish or present their findings at different conferences. And last and most importantly, you are not just becoming a nurse practitioner, a nurse midwife, a CRNA, a nurse scientist, you're becoming a leader. And that's what Penn Nursing is really helping you to do, is to become a leader in your community, in your organization, amongst nurses, nurse practitioners, and through classroom experiences, clinical experiences, we are hoping that we are fostering that leadership for you. A brief overview of application requirements. We require a resume. 3 letters of recommendation. We do like to see at least 1 academic reference, someone from your a direct supervisor reference, and then an employer reference, which means a former supervisor, colleague, someone else who can speak to your professional abilities. We have different essay questions, a copy of your RN licenses. We do require an introductory statistics class, which just needs to show up on your transcript. The GRE scores are required for the MSN and anesthesia programs, but it's waived if your BSN GPA is a 3.2 or higher. If English is not your native language, we require the TOEFL or the IELTS. Transcripts, and the interview is by invitation only. And then last but certainly not least, we have a holistic application process, which means we are looking at all parts of the application. You are not automatically disqualified based on GPA or work experience or references or anything. We are looking at the entire picture, and we comb through your entire application to make sure you're looking at all aspects. We're looking for a demonstrated interest in the population area that you've indicated. Demonstrated interest in research, in a research area if you're applying to one of our postmasters or PhD programs. And again, this doesn't mean that you have extensive research experience. This just means that you have a demonstrated interest in that area. Your passions, your goals, and your reasons for applying to this program. We don't need your 5 or 10-year plan. I don't think any of us have that, but we want to know what you expect to get out of this program. And then lastly, similar to the ABSN program, why Penn Nursing? There are so many different programs around the country. What is it about Penn Nursing that you are interested in? And I think that is it. So oh, nope, so one more slide. These are just our deadlines. We are accepting applications for our part-time MSN programs through March 15th. The application will reopen in July. These are our tentative deadlines. They can always change. So we recommend checking back in the summer once the application launches. MSN programs, they have deadlines based on your enrollment, and then decisions are rolling. So you do need to apply by these certain deadlines, but you'll find out over the course of the year. Nurse anesthesia, postmasters and executive leadership DNP, and the PhD program all have one deadline, and you are notified of your decision at the same time. Now I think I am finished. Again, I do apologize for talking very fast, but wanted to make sure got in all the information. And now I'm going to hand it over to Antoinette.
Thank you, Jamie. All right, so I'm pretty fast. I only have a couple slides and I don't have a lot of details. So I guess you're wondering what types of financial aid are we offering at Penn Nursing, and how are you going to pay for all this, right? So here we go. Next slide. Okay. So for the accelerated program, we have our new and exciting Gutman Leadership Scholars Program that the Dean mentioned. We are so excited. Dr. Gutman and her husband endowed a $2 million scholarship to the School of Nursing, and there's another donor that added to that. So it's huge. And we're really happy. It's for the accelerated and graduate programs. So that's going to, we're actually going to select recipients next week. Yay, Melissa. So that's really good. And that's a $10,000 scholarship towards your award. And the Hillman Scholars Program that Philomena mentioned is actually an $80,000 scholarship program, and that's a loan forgiveness program. As long as you graduate with both degrees, it's totally, you don't owe anything. It's a total scholarship. If you don't graduate with the 2 degrees, then you go into repayment. But everybody that goes into Hillman graduates. You get $30,000 in your BSN portion of the program and $50,000 in your PhD portion of the program. And that goes towards your first year of funding from the school. So that's a wonderful program. The scholars just love it. It's a nice little cohort. And then we have the Dean Scholarship, which we select about 3 to 4 people per year in the accelerated program. And it's based on financial need and merit, which we pull from your scholarship application. From your application to the program for the merit points. We also have the Accelerated Nursing Grant, which is based on financial need. When you apply to the program, you need to submit your parent taxes and your tax returns and FAFSA if you're under 30. If you're over 30, it's all based on the student's information. And we do all these calculations at the nursing school. This is totally, the accelerated program is totally funded by nursing. And then we have the accelerated nursing scholarships, and they're based on merit. And we pull your certain things from your application to determine who's eligible for which award. And the distinguished nursing scholarship is also based on merit, and that's for we look at diversity, first generation, underrepresented groups, all different things, GPAs. So we also pull things from your application for that scholarship. And then we have the Independence Blue Cross Scholarship Program, which is from Independence Blue Cross. Dr. Sikowski applies for it every year, and I'll invite you to apply for it when we receive the funding, and you'll write an essay, and we have a selection committee for that. And then of course there's always loans, and we have federal direct loans. They're undergraduate level for the accelerated program because it's an undergraduate program. You're getting a BSN degree. We have federal Parent Plus loans that you can apply for. You must be under 24 to be eligible. Your parents would apply for that. And most of our students, they take out private educational loans, which we refer to as alternative loans, to make up the difference. So there's lots of ways to fund this program. We have an Office of Institutional Advancement, which is amazing. They're always finding new ways, finding new donors to help fund this program. And the more donors they find, the more we can give out in scholarships. Next slide, please. Thank you. All right, so now I'm going to talk about the graduate and DNP CRNA programs and what we offer for those. So I already talked about the Gutman Leadership Scholars Program. We also are going to offer that for graduate programs, and that's also $10,000. We have the Helen Fold Health Trust Scholarship, which is based on merit, and it's for master's diversity, and it's to build our diversity at the school. Right? Did I leave anything out of that, Melissa? Melissa's really good with this one. So I'm good. All right. So this is brand new. That's why I'm asking her. And I haven't even awarded it yet. This is our first year. And then we have endowment scholarships, which are based on merit. We also award nursing school grants. We're also and that's all pulled out of your application. We have developed a Penn Nursing, Penn Medicine CHOP Scholarship Program, which if you are employed at Penn Medicine or CHOP, when you're in your 4th class in a calendar year, we'll pay the tuition of your 4th class. And it's kind of a buy 3, get 1 free program. It's really a good program. So it's worth it to take 4 classes if you're part-time. So if you took 2 classes in the fall and 2 in the summer, your 4th class is free. Or if you took 2, 1 and 1, your last class in the fall is free. And then we have we have a few various partnership loan forgiveness scholarship programs, and they have work commitments, which when you're in the program, we would get more into there, but we have some for adult GERO, and it's like a 2-year work commitment. It's a $30,000 scholarship. So when you're here, I'll know more like what's available when you get here. And again, we have the Independence Blue Cross Scholarship Program, which is also available for the graduate and DNP nurse anesthesia students. And so now we have loans. We have federal direct loans for graduate students, and then we have federal graduate plus loans. So after you borrow the direct loans are higher when you're graduate students. It's $20,500 per academic year, and then your graduate plus loan would actually fill the gap of your grant, your direct loan, and pay the remainder. You wouldn't have to put out anything if you didn't want to, or you could just pay whatever you need to. And then we also have the nurse faculty loan program, which is 85% forgivable if you work in a nursing school as nurse faculty. You can be nurse faculty and research, but you have to be as employed as a faculty member at a nursing school. You can have a full-time position or 2 part-time positions. And then, of course, if you wanted to go the private education loan route, you can always do that. Some students find better rates. If they have really good credit, they'll do that. Home equity loans, however you want to do, you find the best way to fund your finance your program as you can. And we're here to help you however you need to be. Okay, next program, next slide, please. And now we have the Postmaster's Doctor of Nursing Practice Program, PMDNP. And I apologize. This is the Executive Leadership DNP is so new, I didn't include it, but that is also included in this slide. So, and it's all the same for that too. We also have the Penn Nursing, Penn Medicine CHOP Scholarship Program, the buy 3, get 1 free for the Postmasters DNP programs. The Independence Blue Cross Scholarship Program is available. You'll be invited to apply, as I said before. All the applications come from me if the money comes at a school. And federal direct loans, federal graduate plus loans, nurse faculty loan, and private education loans. Very similar to the master's programs. Okay, and I think that's, do I have any more? The doctoral program. Okay, so for the doctoral program, we have 4 years of full funding. All tuition, fees, stipend, and health insurance are paid by the school. And then we also offer the Independence Blue Cross Scholarship Program. Again, I know I sound like a broken record, but it's great because it's for all our programs. And you'll be invited to apply for it. And we have a selection committee that selects students. And again, federal direct loans. If you want to borrow extra money on top of your stipend, you could also borrow Grad Plus if you need more. And we have the nurse faculty loan program, which is 85% forgivable. Most students in the doctoral program, if they're interested in teaching, they'll take the nurse faculty loan program because that's 85% forgivable, rather than the direct loans or the federal graduate plus loans. And that's even if you need a loan. Many of our doctoral students don't even take loans. But this just helps supplement your stipend. And then a lot of our doctoral students will work a secondary appointment in the school. You can work up to 10 hours a week and be paid a lot in a clinical lab position or an extra TA position. There's all different things you could pick up at the school, lecturer, some just help a faculty member or research. So you could do up to 10 hours a week. You might want to do a 4-hour appointment, however you want to work that out. And if you're an international student, it's 8 hours a week maximum. And if you're a TA for your stipend, you would need to work 16 hours a week for your teaching assistantship. I think that's all I have for financial aid. And then, when you ask questions, feel free. Thank you.
Great, thank you, Antoinette. So now we're going to this slide shows you our upcoming events, and then we're going to go right into our Q&A. In the beginning, this is the first of a 3-part series called Diverse Perspectives in Nursing. Our next panel is February 24th, and that will be a faculty panel, and that will be focus will be on our graduate programs. So you'll meet some of our faculty, particularly for the MS specialty areas, and they'll go a little bit more detail about those programs, the curriculum and the clinical experiences. And then we have another panel scheduled for April 14th, and that's going to be a career panel. And we will have representatives from our Penn Health System. Penn owns 6 hospitals, and they're always looking for nurses. So that's definitely one you want to join. You can register for all of these on our website. The link is below. And then we have our virtual open house. Unfortunately, it's virtual. We love to welcome prospective students to the school, but as you know, we're not able to do that. So it will be virtual, and that's on March 5th. Again, to register for that, just go to the link below. And so now we want to open up, I know there's tons of questions. I see Angelise has had her hand raised for quite some time. So we can do it a combination if you want to come off mute. We'll start with Angelise because I saw her hand up for quite some time. And then we'll also read some of the questions that are in the chat if we haven't answered them already within the presentations. So Angelise, if you want to start, you can come off of mute and ask your question, and then we'll read some questions from the chat, or someone can come off mute and ask their question as well. Angelise? Oh, okay. She said she doesn't have her hand raised. Okay, no problem. Does anyone have a question to ask, or we'll just go to the chat and we'll start there?
I have a question. Do you guys offer any entry like into your BSN program for people who are completing their ADN and receiving their RN license?
Technically, yes, students can apply if you're a registered nurse with an associate's degree, you can apply, you would apply to our accelerated option. That's the application you would complete. The plan of study would be slightly different. I'm going to put my email in the chat box, and then just email me directly and we can have a discussion about the RN to BSN/MSN program. Because there's a lot of little pieces that are difficult to kind of explain. So we can have a conversation about it and talk about it.
Okay, thank you.
Yeah. Mm-hmm.
Hi, this is Monique. I have a quick question. Well, it's two-part. For the PhD program, do you require a GRE for that one?
So the good news is we just, our faculty committee, we just waived that GRE requirement. So for the next application cycle and moving forward, so when our application reopens for the PhD program July 1, there's no longer a GRE requirement. But again, we do look at your application holistically, and really for our PhD program, it's about fit. Make sure you do research on our faculty and see if your research interests align with the faculty. We encourage students applying to our PhD to reach out to faculty. They're very open to that. So if you go to our website, there is a page that highlights our faculty research. Feel free to reach out to them, try to connect with them, because that's really important with a PhD program. We want to make sure that you have an advisor or mentor that can support you during your time. But no, we're waiving the GRE moving forward.
Thank you. And the second question is actually something that a lot of people were asking. Do you have, I saw on the website, you have an MSN PhD or MSN DNP. Do you still offer that? Is that something that would be possible?
So we have an MSN PhD program where you could apply to both the MSN and PhD programs at the same time and continue on. We currently do not have a MSN DNP joint option at this time. Our postmaster's DNP programs are relatively new. We do hope in the next few years to have some sort of bridge program or joint program like we do with the PhD program. But at this time, you would need to apply to our postmasters or executive leadership DNP upon completion of the MSN program. There is a question from Rachel I want to answer that I wanted to clarify since I kind of glossed over it. Is the application for the 2022 cohort for the CRNA program closed? I noticed it's a November 1st, 2021 deadline for 2023 admissions. So yes, our nurse anesthesia DNP program, the admissions process operates about a year and a half in advance. So people who applied this year were applying for 2022 enrollment. So this coming fall, if you choose to apply, you'll be applying for 2023. So keep that in mind. If you're a few years out from applying, you'll be applying about a year and a half or 2 years in advance.
And Phil, I see a question. It says, if you are not accepted into an MSN program, can you still be accepted to the ABSN program?
Yes, yes. So currently, oh, am I muted? No. So currently, if you apply BS and MSN, it is possible to be denied to the master's component, but the admissions committee feels that you're a great fit for the nursing component. You can come in BSN second degree, and then once you get to Penn, you can self-matriculate and apply to the master's once you've been here. You know, a lot of times the acceptance into the master's is just due to limited exposure. So once you're in the nursing program, you're going to have that additional exposure, but it is possible.
Hi everyone, good evening. I have a question with respect to the prerequisites. I had taken I've taken biology, like introductory biology in the past. And in my West evaluation report, it has that. So do I still need to register for introductory biology because I'm almost done with my prereqs?
So you have biology? You've completed it?
I've completed anatomy, every other thing, and I'm taking the remaining except introductory biology.
We still require intro to bio. It's still a requirement
Okay.
for the prerequisite courses.
Even though I had taken it before?
Oh, you took biology before or anatomy and physiology before?
I have taken biology before in my university time.
Oh, no, that's fine then. It'll yeah. If you have intro to biology or cell bio or genetics, molecular biology, that'll meet the requirement.
Well, okay, thank you then.
Yeah.
Which means I'm done. Thank you very much.
It's a good feeling.
Okay. Then also I had filled out my application, but it says the deadline had passed.
Yeah, so the deadline for 2021 has passed. It was October 15th of last year. The deadline for 2022 will be this October. So between July and October is usually when our application is available, and that's when you apply.
Okay, thank you very much.
I do see Modesty has her hand raised. I want to make sure we get to her.
Hi, thank you, Jamie. I do have a few questions, and I wanted to know if you prefer that I ask them now or give somebody else a chance to ask a couple of questions after me, just to be courteous.
Why don't you start with two?
Yeah, that's what I was saying.
So if applicants repeat a class, I just wanted to clarify, would you be looking at the highest grade or would you average the two grades of the retake and the original score?
So we will look at the highest GPA, the highest grade that you've completed. We look at both, and then we want to see an improvement in grade is what we're really looking for.
Okay.
Yeah.
And as far as looking at the transcript, will you all be focusing a lot on mostly the prereqs for the program, or will you be looking at kind of all of the grades from the transcripts as a consideration?
So in terms of we're going to look at your college transcript entirely. Then we're going to look specifically at the prerequisite grades and specifically more anatomy and physiology and anything you've recently completed. So like if you were a bio major and maybe your early freshman year courses didn't go as well, that's something that we see and we understand, and it's an adjustment period. So it's more kind of that transition and that movement in terms of improvement in grades if there's an issue with grades.
Okay, thank you.
Okay, I see a few hands. I think Irene, if you want to go ahead.
Oh, sure. Hello, thank you. I had questions about specific areas of study, and I'm not sure if that's like you guys could speak to that here or if there's someone I should email. I mainly wanted to know more about the Center for Health Outcomes and Policy Research. I'm interested in health policy, and I wanted to know if you had any curriculum around that, or was it mainly just research being done at this center?
So those centers are primarily focused on research. I would say health policy is kind of woven throughout the curriculum, and there are a few policy classes, but those centers primarily focus on research. And you can certainly get involved with them regardless of what program you enroll in.
Is there anyone I could email to find out more?
Yeah, you can
Yeah.
definitely, when you go to our website, I think they each have their own website, and there's usually an administrator or a center director. You can reach out to them, and they'd be more than happy to speak to you. That's what you'll find with a lot of our faculty, is that although they are busy, so they may not get back to you right away, but they will get back to you. And we really encourage prospective students to reach out to our faculty and to our centers to obtain more detailed information.
Thank you.
And I think, is it Corin Joseph?
Yes, Karen. Hi, I have asked previously about some prereqs that I needed to take, but I just wanted to clarify because it was a while back. I think it was Philomena that said that some of the classes could be like 10 to 12 years. I have some classes that I took in like 2011, 2010, not the AMP courses. So I just wanted to clarify for those courses what I would need to take over before applying for the next cycle.
I mean, it depends on the full application, you know, and your transcript and your courses and things like that. But like chemistry, biology, those intro chem bio courses, nutrition, 10 to 12 years is usually not a problem. Micro, as you know, we have new viruses in the world. So you don't want it to be too old because there's a lot of movement with infectious disease. So it really will depend, but the chem, the bio, the nutrition, statistics can be a lot older. And then that anatomy, physiology, definitely within 5 to 6 years, or at least, you know, one of the two is more recent. And then micro is recommended that it's a little bit more recent, just simply for, you know, advancements in infectious disease and what's happening. Yeah.
Okay.
But if it really just depends. If you're a science major, it's less important, right? If you're a bio major, your bio could be 12 years old, but you have such, you know,
so many
really intensive biology knowledge that it's not going to really matter. So sometimes you can go even later for some students. It really kind of depends on the whole kind of trajectory of your coursework.
Thank you.
And I see Elnara.
Yes, hi, good evening. I have a question. Do I need to take any entrance exam or TOEFL, even though I have a citizen of United States? And my bachelor degree is from outside of United States.
Which program are you interested in? The accelerated program or one of our
Yes,
graduate programs?
accelerated nursing.
So if you've completed your degree at an English speaking institution or in the United States, the TOEFL is not required.
No, it's outside of United States and it's not English speaking.
So yes, the TOEFL would be required.
All right, thank you.
Okay. Crystal Thompson. Can't see your last name.
Hello.
Hi. Go ahead.
So I am a nursing student already, and I want to apply to the graduate program. But my main question is, my university has allowed me to take a couple of graduate classes. So would that translate over if I were accepted to Penn?
It's not guaranteed. You could transfer up to 2 classes at the graduate level, but that would be determined after you were admitted.
Okay, thank you.
Christopher?
Hi guys. So my question is about the DNP Executive Leadership Program. As I was reviewing the requirements, it was saying that there is a requirement for 2 years of fiscal management. Does that fiscal management need to be as a nurse leader, or can it be from a different career?
Potentially. Why don't you email me your resume? I'll put my email in the chat, and we can look more into it. but with most things, it could depend.
Thank you.
Kristen?
Yeah, I'm Christine. Nice to meet you. I'm from China as a RN about 6 years, but now I'm studying clinical nursing master in King's College London. So my question is, if I want to apply for PhD or DNP, so I need to submit else and GRE. My university GPA is 3.5. Yeah. So I want to know if I apply PhD or DNP, I need to submit else.
So yes, you would need, if your undergraduate degree was not conducted in English, you would need to take the IELTS or the TOEFL. We don't have a preference. The GRE for the PhD is waived. And were you interested in the postmaster's DNP, did you say?
Yeah.
Okay, the GRE is also waived for that program as well.
Yeah, if I apply PhD, the GRE can waive.
Yes.
Oh yeah, thank you. Thank you very much. I'm
You're
interested
welcome.
more, to be honest, I'm interested more DNP. Yeah.
Great.
That's great.
So
I would encourage you to, we're going to have, so there's going to be an open house, and there'll be, were we doing breakout sessions, Jamie, for the, so I would encourage you, that's on March 5th. You'll get more detailed information on the DNP programs. It's nurse anesthesia, that's a postmaster's DNP, and our executive leadership DNP. And also, if you're, that open house, I don't believe we're going to focus on the PhD, but if you're trying to decide if you want to do a PhD or a DNP, then because they are two very different programs. So it really depends on what you want to do with your career. If you want to do more research and be a nurse scientist, then you would want to do the traditional PhD track. If it's more practice improvement, then you might want to look at the DNP. So I would encourage you to attend our March 5th virtual open house, and we'll have more detailed information on the DNP program specifically.
Yeah. Okay. Thank you.
You're welcome.
Thank you very much.
I'm just going to move to this next slide. I want to be cognizant of the time and people's schedules. We obviously won't get to everyone's questions, so I wanted to put our admissions email should you have additional questions or if we didn't get to your question yet.
And with that, we'll just take one more question and then we'll close out for the evening. And as Jamie said, feel free to email us. We definitely respond to our emails, and we'll get back to you, or definitely attend one of our future events so we can continue the dialogue.
I have a question. Hello. Yes. What if you're not sure about which one you want to go? Or DNP or PhD?
Again, I would suggest maybe you attend our open house. And then if you had specific questions about our PhD, just email us at the address that's there, and we'll get back to you about the PhD program, because I don't believe we have a PhD open house coming up until the fall. So just email us and one of us will get back to you, and then we'll provide you more information on the PhD, but definitely attend the open house on March 5th. You can register for that now.
Okay, perfect. Thank you so much.
You're welcome. So again, wow, thank you all so much for joining us this evening. The questions were fantastic. This is the first of, many virtual information sessions that the admissions office will be conducting, pretty much one per month or two per month. So if you sign up on our events page or our information form, you'll get email information anytime there's an event. So again, thank you very much. We're very excited about our partnership with Thurgood Marshall College Fund. If you have any questions about that, feel free to email me. And again, we look forward to seeing you at our future events. And I wish you all to be safe, and hopefully we'll see you soon as students. So thanks again for joining us, and have a good evening.
Thank you. Thanks, everyone.
Bye-bye.
Thank you very much.
Thank you.
Thank you.
Thank you.
Take care.